Hi, my name is Michelle Sandoval Rosario, and I am the current PACE Region 9 Director. PACE stands for Prevention Through Active Community Engagement, and our office is under the Office of the Assistant Secretary for Health within the Office of Infectious Disease and HIV and AIDS Policy. And today I'm going to talk about a national PrEP campaign that we have launched at HHS to increase the uptake of PrEP. And I'll also be showing you some media toolkits and talking a little bit more about the PrEP program that we have nationally that hopefully is going to help us reach our goal in the next 10 years to end HIV. So again, today I'll be just providing updates on what we call Ready, Set, PrEP. So for those of you who are not familiar, you'll learn a little bit more about the program. I'll talk about I'm Ready, Estoy Listo, which we're very excited, a campaign that we've launched just a few weeks ago. I'll share some messaging toolkit and resources you can use in your health center to be able to reach communities most impacted by HIV. And then I'll just end with comparing the different PrEP assistant programs that we have in California to help us get to zero by 2030. So I want to start with some data. I'm sure all of you are very familiar. This map presents the estimated HIV incidence for individuals less than 13 years of age here across the United States. And this is data from 2018. And I wanted to put this up because as we can see, HIV incidents were highest among 7 states. And we can clearly see that California was one of those states. So when we look across region nationally, we see that 7 states combined, those highlighted in dark purple, accounted for almost 51% of the estimated number of new HIV infections. In 2018, California reported a total of about 47,000 new HIV cases with a rate of 14 over 100,000 new cases. Of those new cases here in California, we know that about 48% were among Hispanic and Latinx, and then 37% were among young adults between 25 to 34 years old. So this really highlights the disparities not only across geographically, but also the disparities that we're seeing in HIV here in California and nationally. The good news is that today we have the tools to end HIV to be able to address these disparities. We have the biomedical prevention tools that we'll be focusing on today, which is PrEP and PEP. But as we all know, unfortunately, many communities don't know about these tools. And there are really large communities, and there are many groups who have not gotten the message about PrEP or how PrEP and PEP can really help us end HIV in the next 10 years. So we have to do a lot of work. So we're hoping that the presentation today will give you an understanding of some of the things we're doing nationally and how we're working with our partners to increase not only the uptake of PrEP, but really the awareness of PrEP among communities most impacted and providers who serve communities most impacted. So I'm sure all of you are very familiar with PrEP, but I don't want to make that assumption. PrEP, which stands for pre-exposure prophylactics, is a prevention tool we have to end HIV. It's a medication that prevents the transmission of HIV. We know that it's highly effective and safe. And I want to emphasize effective when used daily as prescribed. So it's not only about making sure that we prescribe PrEP to individuals, but also it's our job to make sure that they are adherent and they're taking it the way they need to take it to be able to prevent HIV. Now I want to just show some data of what the uptake of PrEP looks nationally and in our communities. And we can see from this map that we have made significant progress in the uptake of PrEP. And if we just look at 1 year between 2017 and 2018, we can see that PrEP increased by 39%. So we have done a really good job increasing awareness of PrEP. However, although we've made some progress, as we saw in the map, we know that there's still over 1 million individuals who could benefit from PrEP, but only about 10% of them are utilizing it. We also know that there are still many regions and communities experiencing disparities, as I highlighted, particularly among those communities that we know are impacted by HIV today. And when we look at PrEP by race and ethnicity, we see significant disparities across racial and ethnic groups, specifically among those groups that we know would numbers really have not changed. And just to give you an understanding, according to the CDC, 2/3 of people who could potentially benefit from PrEP are African Americans and Latinx and Hispanic. However, they accounted for the smallest percentage of those using PrEP. So we know when we look at the epidemic today, we see that individuals of color, including tribal communities, continue to be impacted by HIV. So although the rates are highest among minorities of color, the uptake of PrEP or the use of PrEP is lower. So there's something that we need to do, again, not only making sure that we're increasing awareness, but making sure that we're educating communities most impacted on PrEP and how we use PrEP and why PrEP is so valuable and it's going to help us end HIV. We also see disparities among age groups. Just to give you some data here, in 2018, youth accounted for 21% of new HIV diagnoses. So although they accounted for about 21% of all of the new cases, only 14% of them were PrEP user. So again, not only do we see disparities across racial and ethnic groups, but we also see them across age group. And when we look at the epidemic changing and just in the last few years, we see our youth getting impacted by HIV. There's also disparities among gender. In 2018, only 6% of PrEP users were among women compared to 94% of men. So although the epidemic does impact men greater than women, we also know that the epidemic is impacting women of color, particularly Black women. So we have to do a better job of normalizing PrEP, not only across racial and ethnic group and age, but also making sure we're normalizing it across different genders. I want to talk a little bit about HIV testing before I talk about the Ready Set PrEP program. We know that HIV testing is our gateway to both prevention, which is the opportunity to talk about PrEP and PEP to those who are at risk, but it's also an opportunity for us to link individuals to treatment. And treatment and diagnosis is a very important component to us ending the HIV epidemic. So how do we expand HIV testing to increase prevention? How can we make testing more accessible and available to individuals during this time, during the pandemic? We can do that through HIV self-testing, which we often refer to as home test kits, which is even more important today with the stay-at-home order. Another thing to think about is that many studies have shown that sometimes even an individual that shows up at an STI clinic or a primary care facility will show up with gonorrhea or chlamydia, but not once are they offered an HIV test or PrEP or PEP or even talk about HIV. And these are individuals who we know are at risk of HIV. And unfortunately, within a year, they are having positive HIV test results. So again, testing is an opportunity for us to educate and increase PrEP awareness. And it's also a time for us to be able to not only test individuals, but again, link them to the care that they need. And in fact, the U.S. Prevention Service Task Force just in 2019 recommended that healthcare providers, all healthcare providers, not only HIV specialists or STI physicians, offer PrEP to individuals that we know are at risk for HIV. And this really is a message that healthcare workers need to be able to deliver to individuals at high risk. Others on some of those HIV prevention measures we have, such as PrEP and PEP. So I mentioned a little bit about Ready Set PrEP. One of those things that we've done at the national level is to start the Ready Set PrEP campaign. Ready Set PrEP is a national program that's being led by HHS. It was launched last December, end of 2019. And this program provides free PrEP medications at no cost to thousands of individuals that qualify. So it doesn't only remove cost barrier, but it's also an opportunity for us to increase access to PrEP medications nationally wide. It's a program for those who are uninsured or underinsured. The medication is available at no cost, so there's no copayment. And those who are eligible must have 3 criteria. And those criteria are, number 1, they must have a negative HIV test. They must have a valid prescription from a provider and no prescription coverage. So I talked about underinsured. We know that some individuals might have health insurance, but they might not have prescription coverage. I also want to point out that you don't have to be a healthcare provider or a PrEP provider to enroll someone into Ready Set PrEP. So this is very, very important as you all think about how Ready Set PrEP would fit in your facility. So the way it works is I can walk into the clinic. I can usually you walk in, you're given paperwork to fill out, intake paperwork. The administrator, the PrEP navigator, or the community health worker, often referred as the promotora, can sign me up into PrEP right there. They don't have to be a nurse. They don't have to be a provider. They don't have to be a medical assistant, or they don't have to be certified to enroll someone. It literally takes less than 5 minutes to enroll someone into PrEP. So that's very important because the questions we often get, as we'll talk about the California PrEP Assistant Program, you have to be a center that is a PrEP assistant, so you have to go through an application process and training. So this program allows anyone that works at the health facility to be able to enroll someone. So when we think about the barriers when you get someone into PrEP, we know that's one of the barriers because we know many providers are very busy, that they don't have time to sit and enroll someone. So it just takes, you pick up the phone, it takes less than 5 minutes, or you can enroll them online. In addition, the Ready Set PrEP program is open to anyone, including those without citizenship status, as long as they meet those 3 criteria. So they have to have a negative HIV test, a prescription, and no prescription coverage. I also want to point out that minors can also utilize the program as long as they are not under their parents' insurance, because we do know there are many college students who perhaps don't have any type of coverage. And this is a great opportunity and a great program that will help them pay for their PrEP. The exciting part about the Ready Set program is that individuals can pick up their prescription at more than 32,000 pharmacies across the United States. And this is just, in this slide, you'll see the names of those popular pharmacy chains that are located in most neighborhoods. For those who are interested in getting a longer list and identifying those pharmacies in the neighborhood, especially of those communities that you serve, I encourage you to go on www.getyourprep.com, all one word, or just go to hiv.gov, which is a one-stop shop of everything we're doing at the national level. And I want to mention that we've worked really hard with many different commercial pharmacists across not only the U.S., but in the District of Columbia and Puerto Rico and the Virgin Islands to be able to provide medications through commercial pharmacy networks. And we continue to expand the network and make it more accessible and convenient for an individual to be able to pick up their prescription. And also the most exciting part is that these pharmacy partners have donated their services to distribute PrEP at no cost. So not only are they providing the dispensing services for free, but they're also providing patients with counseling to increase adherence at no additional cost. And we know when we talk about PrEP being successful, we need to make sure that patients, again, are not only taking it, but they're taking it daily and they're taking it the way they're supposed to take it. And we know that it's sometimes harder to get an appointment with a provider than it is to be able to see your neighborhood pharmacist. So this is key for us, and we're very excited that they're able to do this. And even more excited is that beginning sometime in January, I would say at the end of January 2021, individuals will now be able to receive their prescription in the mail without having to go to one of those participating pharmacies. And I don't know about you, but when I walk into my my health clinic, I like it to be a one-stop shop. I want to get my x-rays there. I want to get my medication there. I want to see my provider. The last thing I want to do is get in my car and drive someone else to get my medication. So we know that that's a barrier. So we're very excited because, as I mentioned in January, if I walk into my primary care provider and say, hey, I'd like to get on PrEP, they can enroll me in PrEP within less than 5 minutes. And they can also get my PrEP delivered not only to my home directly, I can get it delivered to the facility or to my healthcare provider in case I live with family who I don't want them to know that I'm on PrEP. So we're very, very excited about that, that they'll be able to now get their PrEP through mail orders. And this is especially great news for community health centers because previously health centers funded under 330 were not allowed to use the Ready Set PrEP program to help pay for PrEP. But now with the ability to receive mail orders, health centers can now utilize the Ready Set PrEP program to be able to provide PrEP to those that qualify. So again, this is a really exciting time for the work that you're all doing. Now you can even help enhance and help address some of those barriers with accessing PrEP through the Ready Set PrEP program. So although Ready Set PrEP program has helped address barriers related to costs, we know that there continues to be other barriers with accessing PrEP. And these are some of the key topic and key themes that we've heard not only from providers working with communities most at risk, but also from the communities itself. And we know one of those major barriers is stigma. Stigma with accessing PrEP, lack of education among individuals at higher risk for HIV and among healthcare providers who don't understand the benefits of PrEP, and as well as challenges with navigating PrEP services. So we understand that Ready Set PrEP is not going to address every single barrier we have when it comes to accessing PrEP. So with that, we know, as I mentioned, stigma is a number one barrier that many of our communities face. And there's one quote that I really enjoy that really resonates and what it means to face stigma. So I was reading this book a couple months ago, and this quote around stigma really stood out to me. It says, stigma is like cold air. You can feel it, but you can't see it. And that really is true when we talk about those communities most impacted by HIV. So another thing I'm very excited about is that the Office of Infectious Disease and HIV and AIDS Policy under the Office of the Assistant Secretary for Health has launched a new PrEP campaign called I'm Ready, Estoy Listo. And this is a pretty amazing campaign because it includes real people, real voices sharing what it means to be on PrEP, with the goal to be able to increase the uptake of PrEP by helping to eliminate stigma. We also know that HIV has no demographic barriers, so the campaign not only features men from the MSM community, but it also features a Black woman, cisgender, trans women, and other Black and Latinx men sharing their stories in both English and Spanish, using storytelling and engaging videos to share how being on PrEP has empowered them to stay healthy and keep their partners happy. So in addition to the launching of I'm Ready, Estoy Listo, we've also relaunched your getyourprep.com. Again, getyourprep.com is led by HHS. And we've made some changes to be able to make it a little more friendly user. We've added different pharmacy chains, so I encourage you to check it out. And as I discussed, along with that campaign, we're also excited that, as I mentioned previously, that now Ready Set PrEP will be available via mail orders. So if you go on hiv.gov, there are a ton of different social media toolkits that you can use on your website, there's language you can include in your newsletter. So I highly, highly encourage you to check them out. And these are just a picture of a couple of them. So now what I'd like to do is just play two videos just to give you a little show of what these videos look like, and they're each 30 seconds long. So I'm going to play one in English and then I'll play one in Spanish.
I knew that I was different. I also knew that I was still a good person. I also knew that I was a whole person, that I wasn't missing anything, or that there wasn't a lack of, because my sexuality was different. And I think it's such an opportunity, not only for this community, but for the world to realize that you can be taken care of. So if you want to date someone positive, or if you just want to remain healthy, there is an option for you. I'm Trent, I take PrEP, and I'm ready.
So now I'm going to play the Spanish video.
Soy nacido y criado en Puerto Rico. Culturalmente tenemos que lidiar mucho con esta idea de internalización de ese estigma por mi sexualidad. PrEP logra romper con esas barreras y decir, podemos proteger nuestros cuerpos, podemos proteger a nuestros compañeros sexuales y también podemos acabar la epidemia del VIH.
Oops.
nosotros podemos cambiar la narrativa. Mi nombre es Damián, yo tomo PrEP y estoy listo para prevenir el VIH.
So again, these are just some videos for you to just get a little quick view of some of those videos. I will be sending a YouTube link so you all can have access to not only the slides, but the videos. You can put them on in your hallway. For example, while patients are waiting to see the provider, you can put them on your social media kit. So again, any way we can provide you support so you can roll these videos out, that would be great. So one of the questions that I often get is, how is the Ready Set PrEP program different from the California PrEP Assistant Program, which I'm sure many of you are very familiar with. So in fact, I will say California is really the leader when it comes to providing PrEP Assistant Program and really leading the way in ending the HIV epidemic. So what I did is, I'm not going to go through this table now. I created a 2x2 table just to really highlight the difference between all of the different programs we have for individuals. So when we talk about barriers related to cost, there should really be no barriers when it comes to costs, right? Because we have many programs in place, either nationally, locally, or through Gilead, that's going to help address any challenges individuals have with costs. So as I mentioned, the Ready Set PrEP program covers 100% of the costs. Anyone can enroll a person into Ready Set PrEP. They can even call and enroll themselves. And there's operators available, I'm not sure 24 hours, but I think into the night, and both in English and Spanish. The one thing I didn't mention is one of the challenges with the Ready Set PrEP program is that it does not cover any clinical visits or labs. And as we know, an individual that's on PrEP needs to see their provider every 3 to 6 months to get an HIV test and check other clinical and other labs, right? So that's one thing. So one of the things that we've encouraged some of our partners in states that don't have PrEP Assistant program is to use a sliding fee scale that community health centers have to be able to pay for coverage. I also mentioned it's for individuals that have no type of pharmacy coverage. And it's also, there is no, what's it called, federal level poverty income level. So anyone, regardless of your income, can use a Ready Set PrEP. Now, if we look at the other side, the California PrEP Assisted program is pretty similar to the Ready Set PrEP program. However, one of the advantages with the PrEP Assistant program is, in addition to covering PrEP, it also covers vaccines, STI testing, and other clinical labs. And one of the things that we've talked to at the California Office of AIDS is, how do we utilize both programs to be able to really address barriers related to accessing PrEP? So through the PrEP Assistant program, as I mentioned, you have to be a PrEP provider. So you have to be a health center or a community health center, an FQHC, that is certified by the Office of AIDS, by the California Department of Health, that you can enroll someone and prescribe someone with PrEP. Unfortunately, we know that many of the providers who are seeing individuals at high risk are not enrolled as providers by the California State Health Department. So that's one of the biggest limitations. The other thing is that we've heard that it can take a long time to enroll someone into the PrEP Assistant program, because you have to prove their income eligibility. You have to make sure they qualify. They don't have any other private health insurance. So the way that we see the Ready Set PrEP here in California, that it really is a stepping stone to get someone on PrEP. So if I come into my clinic and I want to get on PrEP right away, they can use the Ready Set PrEP program to enroll me, and so I can get my PrEP immediately, and then they can work with the Office of AIDS to be able to get me on the California PrEP Assistant program. Because again, the California PrEP Assisted program not only covers PrEP, but it also covers those other clinical visits and labs. And then lastly, Gilead offers two different programs. The Gilead Copay Assistant program offers pays for individuals' copay. So individuals who have health insurance, some of them have copays. Copays can be anywhere from a couple dollars anywhere to a couple $100s. So the nice thing about Gilead is that regardless of your federal poverty level, it will cover your copay. So that's an excellent program for someone who has health insurance. And then we have the Gilead Patient Assistance Program, which is very, very similar to the Ready Set PrEP program. However, it does have an income level, and it also takes work, meaning you have to show proof of income eligibility and you have to submit paperwork. So this can take longer. So again, when you want to get someone on PrEP immediately, you can utilize a national program to be able to get them on PrEP that day, and then you can figure out which of these programs would be more appropriate for the individual. So I'm going to make sure whoever is interested gets a copy of these slides. If there are any other specific questions you have, I'm happy to sit with your health facility and go through each of the different programs and really walk you all through how this would look like in your facility as you get ready to roll out either Ready Set PrEP or the PrEP Assistant Program. I also want to talk about the new role that pharmacies have here in California. So in addition to the different PrEP Assistant programs available in California, here in this state, we have a very unique opportunity to increase the uptake of PrEP and PrEP with the passing of California Senate Bill 159. So as some of you or all of you might be familiar, in early January of this year, California became the first state in the nation to authorize pharmacists to be able to prescribe up to a 30-day supply. Actually, I think it's up to a 60-day supply of PrEP and PrEP. This is really exciting because pharmacists are able to get someone on PrEP immediately without a physician prescription. And the goal of this new Senate bill is to be able to help address the barriers related with access and challenges such as getting an appointment. And now with COVID, I know it's been very challenging to get an appointment. Authorization requirements, checking with insurance, and really insufficient number of providers there are in some of the rural areas of the state. So this is a significant opportunity to be able to increase PrEP among communities who continue to be disproportionately impacted by HIV. And we also know that pharmacists can fill much of the gaps in care, specifically in areas where there's limited access to primary care, some of those rural areas of our state. We also know that most Californians live within a 5-mile radius of a pharmacy, so they might have better access to a pharmacy than they do to their own providers. And most exciting is that PrEP and PrEP is not only covered by Medi-Cal, but it also will be by most private insurance here in California with zero copays, I believe, beginning January 1st. So that's very, very exciting. So I wanted to put this up because, again, there are many different tools that are set here in California to be able to help us increase the uptake of PrEP. So when we talk about barriers to cost, that really should not be a barrier because now we've created many different safety nets that you all can use in your own clinics. And then lastly, COVID is real. It's the elephant in the room, so I want to make sure I talk about it. I also want to reassure everyone that ending the HIV epidemic continues to be an HHS priority, even in light of the pandemic. I also want to share that we have heard from the new administration coming in January that they support ending the HIV epidemic 100%. So we're very excited to work with them, to continue to work with all of you to end HIV. And as you all know, we've seen some tremendous changes throughout our healthcare system and how we provide care, preventable service, just in this last, I would say, almost year. But we know that COVID is here and it's going to be here for a while. I know the vaccines are getting ready to be distributed, but we know that this new normal that we're living in is going to be here for a while. So we need to continue to move forward because we're really talking about people's lives. We're talking about 36,000 new transmission if we don't do things differently. That means that we need to continue to think about how do we expand HIV testing through self-tests, home test kits? How do we expand PrEP and PEP and shift to telehealth? How do we provide services during this time while doing it safely? And we know that COVID has disrupted many HIV services, including testing and PrEP delivery and prevention education. I know all of you have been hit very hard during the COVID. But again, I think that there are many lessons that we can learn from the HIV epidemic that we've been fighting for over 4 decades. So there's definitely best practices that we can apply. We also know that CDC has released guidance for PrEP during this time, and HRSA, CDC, CMS, and other of our sister federal agencies have released guidance around telehealth, teleprep, and I know that the Office of AIDS here in California is doing a lot of work with ensuring we continue increasing the uptake of PrEP through teleprep. So that's very, very exciting. So I encourage you, for those of you that haven't had an opportunity to go on hiv.gov, there's a ton of resources highlighting some best practices, what other states are doing during this time, particularly when it comes to continuing to test and continue to increase PrEP uptake. Other than that, I know that was a lot of information. I wanted to provide my contact information. Again, we are here to support you all. Our office is here in Los Angeles, but we work not only with our partners in California, but with our partners in Arizona and Nevada. So if there's anything we can do to support your clinic, especially as we move into the new year, please let us know. And here's my email address. Thank you so much, and I hope you all found this presentation helpful. Have a great rest of the day. Bye-bye.